Hey everyone, this is a special interview I did with the MGMA, which is the Medical Group Management Association, which is a organization that helps support physicians, especially those in private practice, on the business of medicine and everything related to that. And we talk a lot about how medical practices are and can prepare for coronavirus and deal with this. So it might not be totally applicable to you, but I think it'll give you some good insight into what your doctor's office, what your hospital, what they're thinking about, and what is important for us to figure out as we go through this coronavirus. So hopefully it's helpful, and I hope that you'll find somebody that you can share it with.
Phil, thanks so much for joining us today.
You are so welcome. I'm so glad to get to talk about this because there's so much confusion out there. And I think that, especially in smaller practices or in the outpatient setting, there hasn't been a ton of guidance from anybody on how to deal with coronavirus. So we're kind of making it up as we go and trying to figure this out.
Exactly. So let's just go straight to that. What do we know about the virus at this point? And you and I were just talking offline that it is changing not only daily but hourly and even by the
Right,
minute. There's new announcements being made. So just bring us
right.
up to date about what we know at this point.
At this point, we know that it's spreading everywhere, that this WHO just declared it a pandemic yesterday. And what that means is we're going to see more and more cases in the United States. It's going to continue to rise in the coming days, weeks, and months. The virus seems to most affect the elderly and those with chronic medical conditions. And so we know that those people are more predisposed to have serious illness or fatality from it. And we know there's a lot of uh, worry and anxiety amongst our patients. And I think that's the biggest thing that medical offices are facing right now is trying to help to bring peace in this time of hysteria, this time of basketball courts being emptied immediately of players, of toilet paper being off the shelves for weeks for the $50 hand sanitizer on Amazon, those sort of things. We're just trying to combat that and trying to provide good information for our patients and provide good care at the same time.
Yeah, and fear is something we're going to get into a little bit deeper here in a moment. But let's talk about just the noise, the amplification of noise through social media right now. There's so much misinformation going out there. So, where are you getting your information? Where do you advise other healthcare professionals get their information so they can relay that to their patients as well?
Right. I mean, I think like politics, everything is local. And so the first place that I turn and try and get information from is our local health department, our county health department, and our state health department, because that has really the boots on the ground information that I need to know. And we're getting new health advisories daily or sometimes more than once per day about here's how to best treat, here's what's going on in the community, here's how you should go about deciding who to test and algorithms and everything like that. So I would start locally and see what your local good resources are available because that's really what's going to determine, can I get a test done? Can I send them to the hospital or health department or wherever to get the test run? Are the hospitals overrun with patients? Am I going to be able to get a bed if I have a sick patient? I would start with those local resources. And then I think you can look at the national bodies like the CDC, the health department, the National Health and Human Services, for additional guidance about what's going on around the country and what measures are being taken for our patients. A lot of our patients have big questions about, can I travel? Do I need to isolate my family? Do I need to pull my kids out of school? Do I need to telecommute for work? And those are good questions that both the local and the federal level can help to kind of wade through that information. Those are the main resources that I have turned to. And then talking, with boots on the ground physicians that I know that are in the midst of this as well. So I'm on some pediatric listservs. There's plenty of Facebook groups and Twitter. Those are all places where you can at least see and hear from what other people that are in the thick of it are doing as well.
Yeah. On a personal level, you're a pediatrician at Lincoln
Right.
Pediatric Group in Lincoln, Nebraska. Give us an idea of the size and scope of the practice.
So at our group, we have 12 pediatricians and then about 6 nurse practitioners and physician assistants. So there's just a little less than 20 providers. We're all at a single site. And so we have about 35, 36 exam rooms running on any given moment. And so that's kind of the size of our practice. With that, we have something like 15,000 patients in the community, and we're one of the larger groups in the community. So we take care of probably 30 to 40% of our city's children.
Yeah, you deal with seasonal flu every year, but what's different about COVID-19? What's going on with this particular strand?
Right. So with COVID-19, the things that are different are one, there's really nobody that's immune to it. Because it's a brand new virus. It's just come out of China in the past months, and so people don't. There isn't a portion of the population that's immune to it. And unlike influenza, there's no vaccine to help prevent the spread of it. So the vast majority of people that are exposed to coronavirus will have symptoms. Now, most will have mild symptoms. More than 80% are expected to have mild illness, just like any other cold or respiratory virus. Um, and so it's more, everyone's going to probably see coronavirus at some point in the next 6 months. But can we protect those that are elderly, those that have chronic medical conditions from it? And can we spread out the illness severity? So the measures that we've been talking about locally and at the national level are going to hopefully help to prevent the super acceleration of coronavirus that they've seen in Italy and other countries where they just don't have hospital beds or ventilators to take care of the population. If we can spread out the duration of the illness over 6 months rather than 6 weeks, where some people are getting it early, some people are getting it in the middle of the season, and some people are getting it later, then that will allow our healthcare system to keep up with the demand and the additional burden placed on it.
Is there another virus that we can even compare it to at this point? Is it just a standalone? What is it about this particular strand?
So there's nothing really specific about this particular strand, except that nobody's immune to it and nobody's seen it before. So it's like pandemic flu before the flu vaccine. It affects a large portion of the population because it hasn't been seen. There isn't the natural immunity to it that other people have. And so, but at the end of the day, it's a cold virus. We see coronaviruses all the time, and continue on our daily lives because for the most, for people that get them, it's just a cold virus. So there's other strains, not the COVID-19, but other strains of coronavirus that we see each year, and we don't even know it because we just say, well, this is a cold virus. Take your cough and cold medicine and symptomatic treatment and keep going. And so there's nothing exceedingly pathogenic about coronavirus. It's not Ebola or something along those lines, but it's something that we just haven't seen before. So everyone is susceptible to it.
Right. Now, your patients are children. As a pediatrician,
Right.
what do we know about their resistance or anything else related to them? How are they handling it?
Right. So there's been a lot of news in the past 2 weeks that children aren't having as severe of disease course. I'm not even sure, when they were doing statistics on it last week, there hadn't been any children that had um, died from coronavirus. Certainly some that are ill, and especially if they have other chronic medical illnesses. But a lot of children seem to be quite resistant, not resistant necessarily to it, but not as susceptible to severe disease. It's not clear why. Like I said, there are a lot of other coronaviruses going around just seasonally each year. And so the likelihood is that since kids get cold viruses more frequently and are exposed to more germs, that they've just seen similar viruses enough that they might mount a partial immune response to it, or there's enough overlap that they have some natural immunity to coronaviruses in general. And they just experience a lot of germs and cold viruses every year, so
Yeah.
they get their fair share of them. And as adults, we don't get as many illnesses, we don't get as exposed to as many germs, and our immunity starts to wane over the years.
Right. And just it's one of those things where we want to make sure we're factual with the information. They're not
Right.
immune though, right? Is that
Right, right.
correct?
Kids will still experience it, and the vast majority of kids will still get coronavirus if they're going to get it. They're not just naturally immune to it, but they're healthier and they've seen similar viruses recently enough that they're likely to just have a less severe course.
Okay. Now, in a previous podcast episode, you told us about your wave schedule of seeing
Yeah.
sick patients, seeing well patients. So, what are you currently putting in place to keep those well patients well?
Oh my gosh, that's like been our biggest challenge is we have to continue seeing patients. I mean, we're coming up on school physical season, which is our busiest time of year, and we have to serve our patients and we have to protect our own financial well-being of our practice while protecting our patients, which is a much more important issue. So balancing those things has been something that is evolving over time. We try and get patients back to the room quickly so that kids aren't sitting in the waiting room for a prolonged period of time. Waiting rooms get a bad rap because people sit there and they see everyone with the coughs and colds and everything like that. For the vast majority of patients, though, they spend a lot more time at Target, school, church, out in the community where they're getting exposed to a lot more viruses and things like that. So I try and bring down the waiting room anxiety and worry. But we do try and get them back from the waiting room as quickly as we can. If it's a non-urgent thing that they're coming in for, we may need to start pushing them back and pushing them their appointment back a few weeks down the road and saying, okay, this is a non-urgent issue. Let's get you by for a couple more weeks, and then we can see you once things calm down. Um, once this coronavirus season has declared itself and we know what to expect. So in the meantime, let's see you a couple weeks from now. The other thing that we're starting to do, which I've been working on this week quite a bit, is telemedicine.
Hmm.
Can we avoid bringing sick patients that aren't needing hands-on into the office? Can we use that for parents that are worried, that really just want their pediatrician to lay eyes on their kid and tell them it's okay and that they're breathing comfortably and they're hydrated? Can we use telemedicine for those things? And there's plenty of opportunity to use telemedicine to avoid bringing kids into the office that don't need to, not just sick kids. So we can use that for like a time that I could see it being useful would be med checks. So we do med checks for kids with ADHD, depression, anxiety. Some of them are very stable and insurance just requires us to have them into the office on a regular basis. Can we do those visits as a telemedicine visit where the child doesn't have to come in, catch the germs in the office, miss out on a bunch of school, instead convert that into a telemedicine visit? And the nice thing is that insurance companies and CMS have said, okay, we probably need to embrace telemedicine to try and prevent the spread in the office setting. Let's do a better job of reimbursing for that. So we've had lots of bulletins this week that telemedicine is being covered much more quickly and much more reasonably than it had been, because people are seeing telemedicine is a great way to continue that primary care relationship without having to bring patients into the office necessarily.
Yeah, tell us about that communication with the patients. How are you communicating with them? Is it through
Right.
email blast? Is it a phone bank? What's going on there?
Right. So I think that is an extremely important thing, is to communicate with patients, because they want to know from their doctor what's going on and what they should do and what they need to know. And so the ways that I've done that, one is posting on social media a lot. I
Okay.
created a YouTube series that I've been doing for the past 2 weeks now. And I just recorded another episode before we started talking on coronavirus and updates. And that provides information for my patients, our practices patients, and then just parents in general. Anybody can see that content and learn from it and share it. So that has been really helpful as a way for me to get out information. And I think the feedback that I've got is it helps bring down the calm when you have the voice that's hopefully reasonable and rational, providing good coronavirus related information that's timely and that answers those questions. Today, the one that I recorded that I'll post later today on my YouTube channel was about social distancing and how do we distance ourselves from others, and what are good measures to take, and what's overkill, or what should we try and do. Parents want to know about school, daycare, football practice, soccer games, birthday parties, travel, grocery store, and those are all things that people want to know that information about. So if we can provide that in a convenient format that shows up on their phone, or wherever they're spend their time, then they're going to latch onto that information and have that, rather than what they see in the newspaper, or what they read online, or the horror stories that get just spread because they make good news. um, all of those sort of things. So if we can be present for our patients in whatever medium they like, that will allow us to reach them even when they're not in the office.
Yeah, and that gets to that fear factor that you were talking
Hmm.
about earlier. Let's talk about it from both the staff side of it and the patient side of it. So first, Let's talk about how you're coaching and leading your team there. How do you kind of calm those fears? Or there are certain protocols that you guys are putting in place to make sure your staff feels comfortable, feels confident about how they're handling their day to day and their work with the patients?
Right, that's a huge issue and a special challenge for us because our staff want to serve our patients and they love that and do that so willingly, but they have to protect themselves, they have to protect their family. And if our staff all get sick, then we're not going to be able to continue to care for patients if they're all homesick or they're quarantined. So what we've tried to do is really be intentional about including them in the planning and the communications about how we're dealing with this. So we're talking about, what do we do on the phones if somebody calls and they say, I think I have coronavirus? Well, that's going to go to our triage, and then our triage can help to decide, do you need to come into the office? Can you stay at home? Do you need to go to the emergency department? Can we have you swing by and we'll have one of our staff come swab you for the flu? And if you in the parking lot, and if you have the flu, then we'll have you come in and we can do the assessment. But if you don't, and we're worried that you were exposed to coronavirus, what are the next steps? And that's an evolving thing that we've been working with the health department and local resources and authorities to try and figure out what's the best approach, because we want to obviously care for our patients. We can't send everyone to the emergency department, and we don't want to do that, but we have to figure out how to balance the needs of our patients with the needs of our staff and protect everyone. So making sure that we're really getting good hand hygiene. And like I just had another Purell station show up outside my door that I didn't have before. And I'm like, oh, this
Yeah.
is fantastic, because now I can just, Purell even more often than I already do.
Hmm.
Making sure that we have masks and gowns and figuring out how to get those N95 respirators fitted, because we've never had the occasion to do it before. So working with local community resources to ask for that extra help so that everybody can be on the same page and everybody can feel confident that they're being protected, and our staff just go above and beyond and are willing to just get in there and take good care of patients, and supporting them and encouraging them, and doing things to help make them feel valued is so important too. We've had in our back conference room masseuses. I don't know what the plural of massage therapists
Right.
are, um, doing massages and things like that, and bringing in lunch and other things that we can do to just say thank you for giving of yourself, of your time, putting your own health at risk, to as hope we can minimize that risk as much as possible, but you are putting yourself at risk. And we appreciate that. Our patients appreciate that, and showing that appreciation. It's so easy to just get swept up in the hysteria. It's so easy to get swept up in why aren't people doing more? But if you can show them gratitude, and if you can lead from the heart and help them, um, then we'll talk through it. I think communication, that was really long-winded. I think communication is the most important thing, because our staff want to know what's going on. They want to know what we're doing and what we're going to do if we start seeing more patients, or when we start seeing more patients with coronavirus, what that's going to look like, so that they're clued in and they're not surprised.
Yeah, you talked about the new bottle of Purell that appeared outside your door. So, anyone who's been in a grocery store or a Target or a Costco or any of those type stores are seeing incredible shortages, even
Oh my
bare
goodness.
walls there. So, from a medical practice perspective, what are the supplies that you guys need, and are you finding them in short supply?
We are definitely finding them in short supply, and that's what I've heard from friends across the country that are just trying to get, things that allow them to keep seeing patients. Masks, gowns, gloves, the swabs that you use to swab for respiratory pathogens, those are all in short supply. Soap and those things, gosh, I've seen online like $50 for a refill of Dial soap, on Amazon and things like that. So it's really hard for us to get the supplies that we need. Um, and it makes it much more challenging for our staff to stay safe when it feels like we have to ration our N95 masks, or not have the appropriate gowns and everything like that. So that's something that our staff call every day to see if our suppliers have more in stock, and what can we do to get our hands on some of that, and can we share with, there's other medical practices in our same building that we're in, can we share, because we know that they'll repay us when we share with them, and vice versa, so that we can continue to provide good care, because they might not be needing as much right now and we're needing more, and vice versa, and just kind of work as colleagues, rather than just everyone kind of stockpiling, squirreling up their supplies and holding on to them tight.
Hmm. So, we were talking about instilling that confidence in the staff, but then there's just staffing, the sheer number
Hmm.
of people that you
Right.
have there. So there are a couple of different issues here. One is, what if somebody gets infected on your staff?
Right.
Secondly, um, there are school closings. We're already seeing that. So staff may have to be home with their kids. So
Right.
what are you doing? What protocols are in place to ensure that you have the right number of people in place to then meet the needs of your patients?
To be honest, a lot of that is prayers right now,
Okay.
because it's a true issue, and that's what we've been talking about and trying to work through is like, what are we going to do if schools get canceled here and all of our staff with kids have to figure out how to provide childcare for them, for their school aged kids? Are we going to be able to have staff members or staff members' family watch each other's kids, or I was jokingly saying there's some open office space in the same little office park that we're in. Can we just lease that and open our own little daycare for our staff's
Right.
families?
Right.
I mean, things like that. There's nothing off the table right now because we just don't know, and it requires a lot more innovation than we've ever had to do to figure out what are we going to do if a staff member gets sick, or all of our nurses who sit together get sick, or it just a provider or multiple providers are ill and can't work. How are we going to accommodate that? And at this point, I don't think that we have all of the answers to that. We're certainly trying
Hmm.
to work through, especially the school closure one. Right now, we have spring break for in our community for the vast majority of kids, and so they're already home. And I don't know if that's going to help with the spread, but we've been getting by, with our staff the way they are, despite a lot of kids being home right now, just with daycare and childcare and family members and things like that. But it will be something where I am very confident that we have such good staff that we'll be able to figure that out. And it might be watching each other's kids so somebody can go and pick up a shift. It might be um, opening, a little impromptu pop-up daycare where people can drop their kids off so that our staff can come into work. I'm very confident that our staff will come together as we go through this, and that is something that we can't plan all those things, but if you have good staff that you treat well, they will go the extra mile for you. And so that gives me confidence that, because I know my staff and I know how much they care about our practice and our patients, that we together will find a way to deal with this when those new hurdles that we haven't even anticipated come up.
Hmm. Are there steps then that a practice can take to be ready? I mean, obviously this one is getting us a little blindsided here,
For sure.
but there are different exposures, outbreaks, emergencies that do happen. So
Hmm.
what protocols do you have, or that you would suggest other practices put in place just to be ready, as ready as they can be?
I would say have a group of people from your practice, at each different level. So, physician, providers, the nursing staff, the phones, the schedulers, the administration, get together and talk through what this could look like next week, what it could look like the week after, what it could look like the week after, and what things do we need to have in place so that we're not flying by the seat of our pants when these new things come up and new challenges arise. Now, you'll probably overplan, but like you said, we're way behind as a country in preparing for something like this. So anything that we can do for this or for whatever next outbreak there is in 5, 10, 20 years from now, having those things thought through in advance. I would say start with the idea that next week there's going to be coronavirus patients in your practice and work from there. What is that going to look like for bringing them into the office? Are you going to have a special waiting area for them? Are you going to have them come in a different door? And then who's going to take care of them? Are you going to have specific staff that are at lower risk for severe illness care for them? That's something to talk through. And then from there, what happens when our staff member gets sick? What's quarantine going to look like? I think those would be the first things that I would start with, because I think we're on the precipice of those things as our community and around the country. Is what's it look like when things start to speed up?
Yeah, we've been talking about from the staff side. So let's go back to the patient side for
Right.
just a moment. You had talked about your YouTube videos, other communication through social media. Just wondering from the patient side, what's the communication been like? Have you had an increase in calls, walk-ins, comments on your YouTube and other social media pages?
Right.
What has that information been like? And just tell us how you've communicated then and responded to those patients.
What we've done, we have definitely seen an uptick in the questions and concerns, for me as a physician, and then just for our office, like how we're going to handle it. Patients are worried that their child is going to get sick, or that they're not going to have access to us when their child gets sick, or that they're going to come in for something else and pick up coronavirus because they're here. And so those are big fears that we're trying to address. We've put stuff on our website and our social media to share what our office practices are, and that it's going to evolve, and that, being authentic with your patients and realizing, okay, nobody expected this, no one anticipated this. So just your office isn't prepared, in the business that you do, or school's not prepared, and we're not as prepared as we could be either. And we're going to keep communicating because we don't know what the next week or month holds for us. And so the way that I think that we prepare patients is by telling them that we will be in contact, and we'll be in contact in the way that works best for you. We may have to change your appointments. We may have to do telemedicine visits, but we will keep in contact, and we'll give you the resources that you need to know. And it'll be in an algorithm or something that's easy. Millennial, like our parents, of our patients are a lot of them are millennial or millennial age. They like bullet points. They like the short and sweet. Here's what you need to do if your child is sick. Here's what to do to keep your child well. Those are things that we can pass along to patients and then keep them in the loop as things change. We have the ability to text message our patients in mass, and we can do that, so that we can provide good information as things evolve. Right now, we don't really have coronavirus in the community, maybe just a couple cases, but we haven't had the uptick in questions that will certainly come when we start having a lot more cases in the community, and it's starting to spread amongst families and amongst schools and everything like that. And so I think we're just trying to get our ducks in a row at this point, and make sure our patients are aware that we're getting our ducks in a row. You can count on us as the place to turn for the information that you need as it comes up, and we're going to utilize resources in the community appropriately. We can't send everyone to the ER. We don't want to send everyone to the ER, but we'll figure this out together.
Okay. Do you have a link? I mean, you've got these um, YouTube videos
Yeah,
or letters or announcements on your webpage. What's a good
right.
link where we can send other healthcare professionals so they can model that where possible?
So our website is lincolnpedsgroup.com, and then our my YouTube channel, if you just go to drbshow/coronavirus, you'll find the YouTube series right there, and that is something that you can share with your own patients, as well, or just get the information from. So it's drb.show /coronavirus.
Okay, thanks for that. Now,
Mhm.
do you have any final thoughts and you'd like to share with our audience about the best practices that they can take in keeping themselves and their patients educated and safe at this time? Just something, a small summary where we can take some first steps here and help combat this.
Everybody knows that hand washing is important, and I think we can not reiterate that enough, that that is the best way to prevent the spread. I think the other message that I really want to communicate is that being the calm source of reason and the source of good information serves you and your patients best. And so trying to communicate in a calm manner that shows that maybe we don't know everything, we don't know what's going to happen, but we're going to be here for you as patients, as staff, as fellow physicians and providers, that we are going to work through this together, and we have a team that's going to help. I think that's the biggest message, is if we feel like we're together, if we feel like we have each other's backs and know what's going on, that things will go much more smoothly regardless of how this all plays out. And we have good information from other countries about what we can expect in terms of the disease burden and the um, mortality and everything like that. So we can use that to help guide the choices that we make for our communities and for the individual patients. And I think it's all local, like I said much earlier, is if you can look at what's going on in your community, share that information. If you can develop good local resources and points of contact, that's what's really going to help at the practice level and at the individual patient and physician level to move through this, is to know what's going on locally and turn to local resources.
All right, Phil. Well, thanks so much for sharing these ideas. These are very helpful during some very chaotic times. So thanks so much for this.
You are welcome. Thank you for helping spread this message because I think we can much more easily get through this as a community, as a country and world if we can just continue to communicate in a calm, reasonable, rational, reassuring manner.
Thank you.